Good evening, everyone. My name is Simran Chaudhary, and I warmly welcome you all to today's panel discussion Midlife Reimagined, a 360 approach to wellness and renewal. As October marks Menopause Awareness Month, we are here to shed light on a topic that affects millions yet often remain misunderstood and under discussed menopause. This important conversation, organized by Voice of Healthcare in association with INTAS, aims to break down the complexities surrounding menopause, our natural and impactful life stage, and bring awareness to the holistic wellness strategies that can empower women to embrace midlife with strength, health, and renewed purpose. Today, our esteemed panelists, who are experts, will guide us through an in depth exploration of menopause. They'll share their insights on the physical, mental, and emotional aspects of this transition, offering practical advice on how to manage symptoms and embrace this phase with confidence. So I would like to thank all the panelists for joining us today as we work to normalize and celebrate the journey through menopause, fostering a supportive environment where women feel informed, empowered, and renewed. So let's get started. I would like to start by introducing all the panelists present here for today's panel discussion, starting with Dr. Jignesh Shah, Senior OB-GYN Practitioner, Ahmedabad, President at Indian Menopause Society 2020-21, President Maninagar Medical Association, Vice President at Isoparb, Apmf, Representative for IMF. Welcome to our show, Dr. Jignesh. Uh, Dr. Sneha Bhuyar, Managing Director,
So,
Sukhartha Hospital, Managing Director at Sukhartha Hospital, Maternity and Surgical Nursing Home, Laparoscopy and Fertility Center, Yavatmal. Foxy Chairman, Breast Committee from 2019 to 2022. Governing Council Member at ICOG 2021 to 2023. Amongst Chairperson, Emergency Obstetrics Committee 2020 to 2024. Founder President Vidrabha at ISOPRB. IMA MS Chairperson for MHS and MPH, and President IMA Yavatmal. Welcome to our show, Dr. Sneha.
thank you.
Thank you so much, ma'am. Dr. Dipti Dipak Patel, Director of Love and Care Multispecialty Hospital, Vice President, Indian Medical Association, Surat, Treasurer, Surat OBS and GYN Society, Education and Charitable Trust. Welcome to our show, ma'am.
Thank you.
Thank you
Thank
so
you,
much,
ma'am.
ma'am. Dr. Kaustubh Kulkarni, Clinical Director and Co-founder of Siddhi Life Assisted Reproduction Center. Welcome to our show, Dr. Kaustubh.
Good evening to everyone and to you, Simran.
Thank you so much. Now, we'll be moving forward with a conversation where I would like to start my question answers with Dr. Jignesh on understanding what exactly is menopause so that we can create this awareness to all our general public. So, can you please describe menopause both in medical terms and in everyday language? What are the key signs and symptoms women should look out for?
First of all, thank you, Simran. Thank you, Voice of Health, and thank you, Intas, for organizing this public health awareness webinar. And menopause awareness is very important in 21st century, even in India, as India is advancing country. Now, synonyms for for menopause is rajonivruti, and in English the synonym is climacteric. Menopause word says that it is a pause, but it is not the pause, it is the permanent cessation of the menstrual cycle. So the word itself has some wrong meaning. Let us start with some humor. Previously, the definition of menopause was when men do not pose at you in layman's word. When men do not pose at you, you think that you are entering the menopause. But now, in the 21st century, the new definition for the menopause is me no pause, मैं रुकने वाली नहीं हूँ. So, friends, menopause is the natural part of aging in women, and it marks the end of the reproductive ability to reproduce. Menopause is always a retrospective diagnosis, and it is only diagnosed after 12 months of spontaneous amenorrhea unless it is a surgical menopause and there are depletion of ovarian follicles, so it leads to the estrogen deficiency. Sometimes we wonder that why menopause occur in women so early and andropause occur in male very late. It is only because the ovarian aging is 2 times faster than testes in women, and that is why in women menopause occurs between 45 to 52 years, which is the average age of menopause. And in India, the average age of menopause is 47 years. The second part of the question was regarding the symptoms of menopause. If we describe the symptoms, it starts with the hot flushes. आपको ऐसा लगे कि पूरे शरीर में गर्मी लग रही है, फिर अचानक पसीना छूट जाए और फिर अचानक से ठंडी हो जाए, तो दैट इज कॉल्ड हॉट फ्लसेस. सेकंड इज मूड चेंजेस. सडनली ऐसा लगे कि मैं डिप्रेस हूँ, सडनली ऐसा लगे कि आज मैं बहुत खुश हूँ, कुछ वजह वगर बच्चे पे या हस्बैंड पे गुस्से हो जाओ, तो ये सब भी मेनोपॉज के सिम्टम्स है. देन मोस्ट इम्पोर्टेंट सिम्टम इज स्लीप डिस्टर्बेंसेस. योर स्लीप इज डिस्टर्ब एंड in between the sleep you are awake, so that at the end of the night you have not completed your sleep. In some patients, the weight gain is also observed. It is because of the altered estrogen androgen ratio, and the dryness of vagina is also seen. So, these are the symptoms of menopause. And at the start of the menopause, at the time of menopause transition, you can feel some crankiness, then feeling of sadness, loss of confidence and self esteem, then anxiety, fatigue, then brain fog. Sometimes, without reason, you forget someone's name or some incidents, that is called brain fog. It is also occurring in the menopause. So, this is all about the symptoms. Over.
Thank you so much, Dr. Jignesh, for explaining us all those about menopause and the signs and symptoms to all our audience in such a layman language, so that it is very easy for them to understand this complexity or the process, I should say, and how does it affect a woman in a body. So, moving on to my next question to Dr. Sneha. Ma'am, what age do women typically start noticing changes related to menopause, and how can they be best prepared for all this transition?
First of all, a very good evening to one and all. Thank you so much, Voice of Health, Intas, and of course Simran, for having me here. As this is mainly the program for public awareness, I think it's better if I speak little Hindi in between. So the
Sure, ma'am.
average age of menopause, as Dr. Jignesh has already talked about, what is menopause? The absence of menstruation for 12 months, that is 1 year. So usually it is 45 to 55 years of age with an average of 52 years. सो इफ अगर आपके पीरियड्स जो है रजो निवृत्ति जैसे बोला जाता है, अगर वो 40 ईयर्स से पहले होता है तो हम उसे प्री मैच्योर मेनोपॉज बोलते हैं. इसका पूरे बॉडी पे बहुत गहरा असर होता है. अगर ये 45 से पहले मेनोपॉज होता है, रजो निवृत्ति होती है, तो इसे हम बोलते हैं अर्ली मेनोपॉज, यानी जो नेचुरल से थोड़ा पहले है. But if the menopause happens after 45 years of age, then it is the natural age for menopause. तीनों भी सिचुएशंस में, जैसे कि डॉक्टर जिग्नेश हैज ऑलरेडी टॉक्ड अबाउट, जो जो सिम्टम्स आते हैं, मेनली हॉट फ्लैशेस, नाइट स्वेट्स, vaginal dryness, and the urogenital symptoms. Of course, it has got very deep impact on the mood swings and the anxiety, and of course, as you said, forgetfulness or the brain fog. How you have to get prepared, that is the most important question. Basically, सबको ये समझ लेना चाहिए कि ये एक नेचुरल स्टेज है लाइफ की. जैसे हम छोटे से बड़े होते हैं, एडल्ट होते हैं, फिर रिप्रोडक्टिव एज ग्रुप होता है, तो इन कंटिन्यूएशन दिस इज जस्ट अ स्टेज ऑफ आवर लाइफ जहाँ रिप्रोडक्टिव एज ग्रुप खत्म होता है, नॉट द लाइफ, ओनली इट्स द रिप्रोडक्टिव एज ग्रुप। तो सबसे पहले हमें ये समझ लेना चाहिए कि ये नेचुरल स्टेज है, देन वी हैव टू प्रिपेयर आवरसेल्व्स। जो भी सिम्टम्स है, जो बहुत ज़्यादा हमें अगर इनकैपेसिटेटिंग लगते हैं, उसके लिए हमें खुद को कंसीडर करना चाहिए, और सिम्टम्स ट्रीट करने के लिए जो भी रेमेडी जरूरी है, वेदर इट इज डोमेस्टिक और मेडिकेशन और हार्मोन थेरेपी or just a supplemental, general your lifestyle modification, active physical lifestyle and healthy diet, I think that is all which we have to take care to prepare ourselves to face this menopause. That's all from my side.
You explained this such in such a beautiful manner, ma'am, that this is just a stopping of the reproduction. That nothing is being stopped; it's just the reproduction which is stopping its work, and something nothing regarding your life or something. So, thank you so much for explaining this so beautifully to all our audience. Moving on to my
Yeah.
next question, Dr. Deepti. Yes,
I'm
ma'am.
sorry, I missed the second part of the question. That क्या हमें ये पता चलता है? Can you predict that whether this menopause is going to happen, and what are the symptoms? As I have already explained, how you have to prepare yourself. But as Dr. Jignesh Bhai has already said, menopause is a retrospective diagnosis. एक
Right.
साल पीरियड जब बंद होते तो हमें उसको मेनोपॉज आया है, अचीव
Uh,
किया है, ये कह सकते हैं। बट देर आर सर्टन सिम्टम्स की जैसे पीरियड्स की इरेगुलरिटी है, और ये जो सिम्टम्स हम अभी डिस्कस करें, अगर ये जो 3 to 5 years पहले शुरू होते हैं, तो हमें पता लगता है कि मेनोपॉज शायद क्लोज है। दैट्स ऑल। थैंक यू।
Thanks a lot,
all
ma'am.
right.
Thank you so much. Moving on to my next question to Dr. Deepti. Ma'am, what are the most common symptoms of menopause and how do healthcare providers typically diagnose the stages? As Dr. Sneha also explained us the stages of this. So, how does we typically diagnose this?
Right. Thank you, Intas and Simran, for this public awareness webinar and involving all of us for this wonderful social work. For the symptoms, most of the patients are having symptoms, but as Jignesh Bhai have told that it is retrospective. So when patient come for other complaint to our hospital, at that time they say, if we ask them, they tell us that they are having asthenia, mood swings, and this urogenital problems, burning, sexual life is also disturbed, sleep is disturbed. But many of the patient, it is transitional also. So coming to the symptoms, most of the patient in which period, menopausal period they are coming, depend on that symptoms are there. If they are coming in early phase, then most of the time they are the vasomotor symptoms. Means उनको क्या लगेगा कि ऐसे एकदम से, जैसे मैडम ने बताया, सर ने बताया कि एकदम पसीना हो जाएगा, सब घर में ठंडी है, सबको ठंडी लगती है, लेकिन उसको एकदम से गर्मी लगेगी. That is most common symptoms and very annoying symptoms. At that time she will feel the palpitation also. मतलब कि जो हार्ट बीट्स हो तेज हो जाएगी. Other symptoms, if she is coming after 3, 4 or 5 years of the menopause, then most of the symptoms are urogenital atrophic symptoms like frequency of micturition, burning at the time of intercourse. Then they are having typical burning sensation at the time of passing of the urine. And if we examine them, there is no sign of the infection, or urine examination will be also normal. So all these symptoms are due to the hormonal withdrawal. Sleep is also disturbed. Quality of sleep means hours are also less. They will wake up early in the morning. They will not have a deep sleep. And irritability, mood swing, all these symptoms are जैसे पूरे फैमिली को लगेगा कि मम्मी चेंज हो गई, वाइफ चेंज हो गई, क्या हो गया, right? So these all are the symptoms. And not only the female, but also the family and male partner should be also aware of made aware of all this problem. So there should be there will be a transitional smooth transition of the menopause for the female.
You explained it in such a simple language, ma'am, that what are the stages or what are the changes a woman's body go through when they are experiencing menopause. So thank you so much for sharing all such changes to our audience in such in-depth and simple language. Moving on to Dr. Costo. So, what role does hormonal change play in fertility during pre-menopause, if I have to ask?
So, first of all, Simran, thanks a lot to Intas. Good evening to all my co-panelists, and for you to have taken the initiative in going forward on a topic that is slightly away, थोड़ा हटके है. ये टॉपिक जो है ये एक मेनोपॉज सोसाइटी के डिस्कशन में एक्चुअली आया कैसे, इस पर बहस पहले करनी चाहिए कि पेरीमेनोपॉज के बारे में हम क्यों जानना चाहते. तो आई थिंक
Shall I speak in between? ये इनफर्टिलिटी के सारे पेशेंट मेनोपोजल एज ग्रुप के ही होते हैं.
जी, तो
Yes.
बस वही बात मैं करना चाहता था कि आजकल हमारे चाइल्ड बेयरिंग एज ग्रुप की जो मतलब द एज एट विच वी वर कंसीविंग हैज इंक्रीज्ड बिकॉज ऑफ वेरियस प्रेशर्स. सो अ टिपिकल गर्ल में वांट टू कंसीव ओनली आफ्टर 35, और वो 35 के बाद अगर वो 40 तक पहुंचती है विथ वेरियस अदर थिंग्स, इट इज़ इम्पॉर्टेंट टू अंडरस्टैंड कि भाई मेनोपॉज अगर इनको आने वाला है तो मेरे चैलेंजेस डबल हो जाते. तो एज अ डोमेन एक्सपर्ट इन फर्टिलिटी मैं ये कहना चाहता हूँ कि दो वजह से मेनोपॉज के बारे में जानना ज़रूरी है. एक कि जो मेनोपॉज हम केवल नैसर्गिक रूप से जो आता है उसकी मैं बात नहीं कर रहा हूँ, लेकिन जो मेनोपॉज हम कुछ दवाइयों की वजह से लाते हैं, या मान लीजिएगा कोई सर्जरी हमने करी है, जैसे मान लीजिएगा किसी के एक ओवरी निकाल दी गई हो या ऐसा कोई हुआ, तो क्या वो माता बन सकती है. सो मैं थोड़ा इस पर हटके बात करना चाहूँगा सिमरन, एंड आई होप आवर ऑडियंस रेजोनेट्स विद दीज आइडियाज. तो नंबर वन, द चैलेंज इफ अ वुमन डिसाइड्स टू हैव अ चाइल्ड when she is between 40 and 50, and we take into account everything that our previous speakers have mentioned, तो मेरे challenges क्या है या एक fertility expert के challenges क्या है. तो सबसे पहले हमें दो चीज़ों का ध्यान रखना है कि जो ओवरी से बीज निकलने की जो क्रिया है वो नैसर्गिक रूप से कम या बंद हो जाती है या अच्छे क्वालिटी की नहीं रहती. तो द फर्स्ट चैलेंज इज कि अपने खुद के अंडे से बच्चा पैदा करना शायद मुश्किल हो जाता है. सेकंड, इसको पकड़ के अगर हम चले कि साइंस ने हमें ये आधार दिया है कि हम एग डोनेशन के लिए जा सकते हैं, लेकिन एग डोनेशन करने पर भी जिसके लिए सख्त कायदे कानून है, उसका बिल भी पास किया गया है, तो अगर हम वो अटेम्प्ट करते हैं तो प्रेगनेंसी सक्सेसफुली 9 महीने तक जाना ये ज़्यादा इम्पॉर्टेंट है, न कि केवल प्रेगनेंसी. और उसके चांसेस अबॉर्शन होने के 3 गुना बढ़ जाते हैं जब 40 क्रॉस करते हैं, चाहे वो अंडा खुद का हो या अदरवाइज. Complications of delivery, complications related to the baby because of prematurity, mother because of the complication वगैरह वगैरह. तो बहुत अच्छा होगा हम इस बात को समझे कि if child bearing needs to be done because हमने या तो पहली संतान नहीं पाई हम 40 होते हुए, और अगर 40 और 50 तक हम जाएं जबकि हम निस्संतान थे या किसी कारण की वजह से हमारा एक बच्चा या जो भी था वो मतलब वी हैव लॉस्ट द चाइल्ड, तो दोबारा क्या वो माता बन सकती है. तो इट्स एन इंटरेस्टिंग डिस्कशन, एंड आई अश्योर यू हमें ART बिल ने अलाउ किया है कि 50 साल की उम्र तक up to the age of 50 a woman can become a mother. So the challenge in this area, ये एक पूरा डिस्कशन शायद हमें दोबारा करना पड़ेगा बिकॉज ये बहुत बड़ा टॉपिक है, लेकिन ये नामुमकिन नहीं है. तो आपको ये जानना बहुत ज़रूरी है कि बिटवीन द पेरीमेनोपॉज मतलब 40 होने से पहले या इवन 40 के बाद आप माता बनने की इच्छा पूरी कर सकती हो. कई केसेस में अर्ली 40s में खुद के अंडे से हो सकता है. अगर वो नहीं भी हुआ तो आशा की किरण इस तरह से होती है कि आप फिर भी अपनी फैमिली कंप्लीट कर सकते हो, या अगर निस्संतान हो तो बच्चा पैदा कर सकते हो. इसके लिए जो चैलेंजेस है वो ज़रूर है, और इसमें मेनोपॉजल मेडिसिन का ही आधार लेकर हमने काफ़ी चीज़ें, फॉर एग्जांपल हार्मोन्स का जो इम्बैलेंस होता है उसको हम ठीक कर सकते हैं. लेकिन ये नामुमकिन नहीं है। सबसे पहला मैसेज सिमरन हम ये देना चाहेंगे, एंड आई एम श्योर माय को पैनलिस्ट अग्री विथ मी, कि ये सबसे ऊंचा शिखर है। अगर कोई पेरीमेनोपॉज एज में या मेनोपॉजल एज के जस्ट पहले माता बन सकती है अगर स्त्री, तो इससे कोई बड़ी अचीवमेंट नहीं हो सकती अगर वो बच्चा चाहती है।
I think you touched upon very important topic, and we discussed about so much of things which are related to menopausal, premenopausal. But thank you so much for enlightening us and our audience on such an interesting topic. As you said, this is just this would require a complete panel discussion. This is not just a
True.
small topic, but we'll be discussing more on this. So moving on to my next topic of discussion today, that is the that is the myths and coping strategies for menopause. So Dr. Jignesh, starting with you, what common myths about menopause do you encounter in your practice, and how can we encounter them with accurate information? Because if I have to say or relate to my example, women or ladies around me, those who were going through menopause and everything, they were so worried. Oh my God, what has happened? I think something has happened to my cycle. I'm not getting my periods on time. So what I realized was ki nowadays also few of the women who are turning into 45, 50, they are also not much aware about their menopause. So in that case, there's so much of myths and misconceptions around it. So how do you encounter it?
सबसे पहले मैं जो डॉक्टर कौस्तुभ ने जवाब दिया उसके बारे में कहना चाहूँगा कि इन फ्यूचर मेनोपॉज एंड इनफर्टिलिटी विल बी द बिगेस्ट इश्यू as Indian women are also getting late marriage, and one more thing is premature ovarian insufficiency. Yes.
So
This
please continue.
this is also prevalence is also very high in Indian population, so it is going to be a big issue in future. Now regarding about the myths associated with the menopause, तो पेशेंट क्या मेनोपोज लेडी क्या सोचती है मेनोपोज के बारे में, तो सबसे पहला तो वो जब हमारे पास आती है तो बोलती है कि मेनोपोज तो एक नेचुरल प्रोसेस है, उसकी ट्रीटमेंट क्यों करनी चाहिए। तो हमें उसको बताना चाहिए कि भाई हम मेनोपोज ट्रीट नहीं करते, वी आर ट्रीटिंग द सिम्टम्स ऑफ मेनोपोज एंड वी आर ऑफरिंग यू हेल्थी लाइफस्टाइल एंड क्वालिटी ऑफ लाइफस्टाइल। देन सेकंड इज वो बोलती है कि मेनोपोज के सिम्टम्स तो सब में एक तरह के होते हैं, बट द सिम्टम्स ऑफ मेनोपोज आर हाईली इंडिविजुअलाइज एंड द ट्रीटमेंट एंड मैनेजमेंट ऑफ मेनोपोज is never ready made, it is always highly individualized and tailor made. तीसरा important in 21st century aspect है about the sex life and menopause, because in past years it was believed that after menopause sex is undignified, then sex is boring when you get older, and men and women lose their ability to perform sex when they get menopause and later age. So these all are the myths. With careful treatment and menopause management, you can have sexual life even at the age of 60 and 70, and it is an important parameter of health in healthy couple. But to some extent, after the menopause, the blood flow to clitoris and vagina is decreasing, and this leads to less vascularity and less amount of lubrication, which is a cause for uh, uh, painful intercourse. And sometimes at this age, there are associated comorbidities and also the social issues related with their children, related with the society are associated. It may lead to the decrease in the sex drive. देन वन मोर इम्पोर्टेंट इज रिगार्डिंग वेट गेन, कि सबको ऐसा लगता है कि मेनोपोज में वजन बढ़ जाता है, तो थोड़ा सा बढ़ता है अप टू 1 or 2 pound. इट इज बिकॉज ऑफ द एल्टर्ड इस्ट्रोजन एंड एंड्रोजन रेशियो, बट विथ थेरापिटिक लाइफस्टाइल मैनेजमेंट यू कैन कंट्रोल इट. देन कई लोगों को ऐसा लगता है कि मेनोपोज स्पेशलिस्ट के पास जाएंगे तो वो लोग हार्मोन थेरेपी लिख देंगे और हम तो हार्मोन थेरेपी लेना नहीं चाहते. but it is not like that, because only 10 to 20% of the patients, they require hormone therapy, and rest of them are cured with the therapeutic lifestyle management. तो ये ख्याल अपने मन में से निकाल देना चाहिए कि मेनोपॉज मतलब सब खत्म, यू आर गेटिंग ओल्ड. इट इज अ न्यू era, new reincarnation of your birth that you can feel. So this is about the myths around the menopause.
Thank you so much, Dr. Jignesh, for clearing out all the myths and misconception that is surrounded to the women's around, the age of menopause, because all such awareness is very important. And like also Dr. Costa mentioned, ki there's something or some of the topic which is not yet much touched about it, right? So that's why we want to clear the air around or the misconception around menopause. Moving on to my next question to Dr. Sneha. Ma'am, how can menopause impact mental health in terms of osteoporosis and heart disease? And what preventive measures should women consider about this? Dr. Sneha, am I audible to you? Dr. Sneha?
She has lost the connection.
I believe so, maybe because she is in airport. I would request Dr. Dipti, would you take this question? Should I repeat the question, ma'am? Ma'am, you're on mute, ma'am.
Yes, menopause affect not only the urogenital system or vasomotor system, but it affects the bone system, and then cardiovascular, neurological. All the systems are affected. Osteoporosis occurs means before starting the menopause, before 3 to 4 years of the menopause, bone loss occurs. That is almost 4 to 5%. And after the menopause in the first year, almost 6 to 10% of the bone loss occurs. And that depend on the patient's age, what is the socioeconomic status, what is her nutrition level, and all that thing depends. That all that things affect the level of the bone loss. Then heart disease. Heart disease, estrogen hormones, that is female hormones, that is very much protective, cardioprotective to the woman. अपने देखते हैं तो जो 40 years या 40 years की एक एज देखते हैं उसमें कार्डियक प्रॉब्लम, हार्ट डिसीज, अंजाइना, वो जो प्रॉब्लम्स होते हैं, हाइपरटेंशन, उसकी जो सीवियरिटी और नंबर्स मेल में जितनी होती है उससे फीमेल में कम होती है. व्हाई? दैट इज बिकॉज ऑफ द एस्ट्रोजन हार्मोन्स. So this, when the menopause occurs, this protective effect of this hormone estrogen is goes off. So women are very much vulnerable for the all these cardiac diseases, and this lipoproteins, cholesterol, all these compositions are also changed because of the lack of the estrogen. So heart disease, osteoporosis prevalence is very high after the menopause.
Thank you so much, ma'am, for explaining all such things to us. Moving on to my next question to Dr. Kosto. Sir, what options are available for women experiencing fertility issues during perimenopause?
करेक्ट. सो हम अपने उसी टॉपिक को, जिसको पेरीमेनोपॉज या 40 के आसपास के एज में अगर वो फर्टिलिटी चाहती है, तो आपको ये समझना है. पहले मैं डिस्क्राइब करना चाहूँगा विमेन डिस्क्राइबिंग मेनोपॉज. तो इमेजिन करिए कि आपको माउंट एवरेस्ट चढ़ना है और टू ऐड टू द प्रॉब्लम आपकी दोनों टांगे जो है वो तोड़ दी हो. तो फर्टिलिटी अचीव करना इज लाइक क्लाइंबिंग माउंट एवरेस्ट ऑन अ व्हील चेयर. तो अगर ये इम्पॉर्टेंट लेसन ये है कि हम बॉडी को मॉडिफाई कर सकते हैं, हम बॉडी को अपनी तैयारी से, आई एम टॉकिंग ऑफ जो दवाई देते हैं, और मेनोपॉजल मेडिसिन का आधार लेकर ही कौन से हार्मोन कितने दिए जाए, इससे यूट्रस को प्रिपेयर किया जाता है ताकि मातृत्व उसे मिले. अब जो सिम्टम्स डिस्क्राइब किए गए या अभी जो हमने डिस्कशन किया सारा, जिसमें उनके सिम्टम्स बताए गए, ये कुछ हद तक कम अवस्था में होते हैं, लेकिन हमें गर्भथैली को लायक बनाना है। मतलब वी वांट टू प्रिपेयर द यूट्रस आइदर विथ हर ओन एग्स और विथ डोनेटेड एग्स, जिससे एम्ब्रियो रखने के बाद वो सही तरह से विदाउट मेजर कॉम्प्लिकेशंस आगे बढ़े। तो मुझे ये बताना है कि ART का मतलब ही ये हुआ कि शायद 40 अगर आदमी या औरत खास करके वहां तक पहुंची हुई है और उसकी मन में जो इच्छा थी या दोबारा उसे प्रेग्नेंट होना अगर है, तो ये अचीव किया जा सकता है, एंड दैट इज द बिगेस्ट बून मुझे तो लगता है इन द रीसेंट एडवांसेस। अब हमें ये प्रिपेयर करने के लिए ART का इस्तेमाल, असिस्टेड रिप्रोडक्टिव टेक्नोलॉजी ART का इस्तेमाल किया जा सकता है, पर जाहिर सी बात है कि इसको रेगुलेट करना ज़रूरी था, जिसके लिए फिर बिल आ गया। मैं उस पर भी बहस नहीं करूँगा। अब सवाल ये है कि क्या वो प्रेगनेंसी जो हम अचीव करना चाहते हैं वो सेफली जाने में हमें मेजर कोई प्रॉब्लम्स आएगी। तो मैं 2-3 चीज़ों पर खास ध्यान दूंगा, और वो मदर की तरफ से। तो बच्चे के लिए प्रॉब्लम्स क्या है वो 1 मिनट के लिए हम छोड़ दें। What are the challenges the mother will face around perimenopause if she conceives? मतलब अगर वो माता बन रही है उस वक्त पे, तो 3 गुना ज़्यादा चांस डायबिटीज़ का, उनमें खास करके अगर फैमिली हिस्ट्री है तो। हार्ट डिसीज़ का जिक्र जो किया था वो अगर है, फैमिली हिस्ट्री है या हाइपरटेंशन की खास करके हिस्ट्री है, तो कॉम्प्लिकेशंस होने की गुंजाइश बहुत ज़्यादा हो जाती है। तो कई बार हमको लोग पूछते हैं कि क्या हम प्रिपेयर कर सकते हैं, तो इसी पर जो है वो बहुत सारी बहस होती है। तो एक तरफ हमें पेशेंट्स कहते हैं, बहुत सारी उम्मीद लेकर आते हैं कि हमें प्रेग्नेंट होना ही है, माता बनना ही है, और दूसरी तरफ हमें ये दिखता है कि दे आर नॉट द कैंडिडेट्स जिनके लिए वो जो है वो 9 महीने का जो सफ़र है वो तय कर सकते हैं सेफली। पर कई बार जो है वो हमें उनकी सुननी पड़ती है, या साइंस को हम उसकी जो लिमिट्स है उसको हम पुश करते हैं। सो द गुड न्यूज़ इज़ कि एज ART विच इज़ नाउ मोर देन 50 years ओल्ड, अगर इस बात को हम लेके चले तो वी हैव बीन पुशिंग द एनवेलोप, वी हैव बीन पुशिंग द बाउंड्रीज, वी हैव मैनेज टू रीच 40 and 50। आपने कई ऐसे
हाँ कुल
केसेस सुने होंगे जिसमें यू हैव एंडेड अप हैविंग प्रेगनेंसीज एंड सेफली एट दैट। जैसे मल्टीपल प्रेगनेंसीज एक चैलेंज था, वैसा ये भी एक चैलेंज था। अनफॉर्चुनेटली अगेन मैं थोड़ा ओवरव्यू ही दे रहा हूँ इसमें, कि यूट्रस प्रेपरेशन साइंटिफिकली किया जा सकता है। एक औरत जो 40s में
एकला
है,
ना जाए। हाँ
अगर वो अकेले ही चाहती है कि भाई ये प्रेगनेंसी जाए, तो ये हो नहीं पाएगा। इट इज़ अ टीम और इट इज़ अ ग्रुप। सो आई विल टेक फॉरवर्ड अ सिंपल थिंग कि फर्टिलिटी का जहाँ तक सवाल आता है, सिमरन, इट इज़ नॉट जस्ट द फीमेल, स्पेशली इफ शी वांट्स फर्टिलिटी, उनका जो पार्टनर या हस्बैंड होगा उसने भी, एंड उसके साथ पूरे फैमिली का यूनिट। तो मोर और लेस वो वही चीज़ें सारी आती है। ये है मानना लेकिन कि प्रेगनेंसी रहने से लेकर अप टू 50 years द चैलेंजेस आर मल्टीपल, देर आर रूल्स अबाउट इट। बट अगर ये सारी चीज़ों को हम इग्नोर करें फॉर अ मिनट, एंड अगर हम ये सहे कि कई ऐसी बहनें हैं जिनको प्रेगनेंसी रही है बिटवीन 40 and 50, तो वी हैव ड्रॉन लेसन्स फ्रॉम द हार्मोनल इम्बैलेंस। तो मैं बस जिग्नेश भाई ने जो कहा था उसी को लेकर आगे बात को दोहराता हूँ। जैसे 14 या 15 ईयर पे एक औरत के लाइफ में हार्मोन्स बहुत ऊपर नीचे जैसे जाते हैं, वैसे ही यहाँ बिल्कुल कायदे से नीचे आते हैं, और इनको वहीं पे पकड़े रखना है आपको 9 महीने तक, ताकि वो संतानवश या संतान उसको मिले जब वो चाहती है। तो आई थिंक द चैलेंजेस से ज़्यादा इम्पॉर्टेंट है कि ये एक साइंस है, और इस साइंस का आधार, इसमें हमारे 2 पैर जो है वो एक तरफ हमारी फिजियोलॉजी, मतलब जो हम लोग कहते हैं असिस्टेड रिप्रोडक्टिव टेक्नोलॉजी वाली जो फिजियोलॉजी है वुमन की, और दूसरी तरफ हम मेनोपॉजल मेडिसिन पे एक अपना पैर रखते हैं। और इन दोनों के थ्रू जिस भी तरह से ये 9 महीने जाए और उसके बाद उनका मेनोपॉज भी अगर आना हो तो उन्हें तकलीफ ना हो, मतलब इट इज़ नॉट समथिंग दैट अ वुमन नीड नॉट इमेजिन, बट येस, a woman who eventually has that baby late in life thanks to ART will also go through menopause, and that is where I believe ये सारा जो एडवाइस अभी मिल रहा है that can be helpful। तो I think मैं जनरल जवाब दे रहा हूँ कि ART is a very hopeful thing up to 50 years, yes, बट क्या हर एक औरत माता बन सकती है? मे बी नॉट। उसमें हमें रियलिस्टिक रहना है। बहुत बड़े कॉम्प्लिकेटेड डिसीजेस अगर हो जो ऑलरेडी कॉम्प्लिकेट कर रहे हैं तो अवॉइड करना है। पर अनफॉर्चुनेटली उतना ही अवेयरनेस हमें फिर शायद अडॉप्शन के बारे में करना होगा या बहुत सारी चीज़ें, बट दैट इज़ अनदर टॉपिक फॉर अनदर डे. Again, difficult to answer that question, but like I said, I am supposed to be a domain expert in that area. And ऐसी बहुत सारी बहनें हमें दिखती है जो मेनोपॉज के पास जाती है और उनमें जो दवाइयाँ दी जाती हैं वो दवाइयाँ, as the panelists have mentioned, they are being given to be as natural as possible, जो हम fertility में भी try करते हैं, and as less harming to the body of the woman as possible, knowing fully well it is a transition towards a different kind of life. So fertility expert के तौर पे मैं इतना ही कहूँगा कि it is possible to conceive, but as a person who can treat a patient of menopause, they have special requirements. पूरी family affect होती है, as was rightly put. सारे सारे लाइफ के जो है वो डायरेक्शंस चेंज होते हैं. एंड लास्ट एक छोटा सा पॉइंट, अ वुमन हु हैज अ चाइल्ड इन हर 40s हैज डिफरेंट चैलेंजेस. तो कई बार ये पूछते हैं कि भाई बच्चा जब 20 साल का होगा तो आपकी क्या उम्र होगी, पर अगेन यू आर एज ओल्ड एज यू थिंक यू आर. एंड दिस इज द टेक होम मैसेज दैट आई थिंक आई वांट टू गिव all the people who are listening to this podcast. And fortunately science has progressed with your dreams, so hopefully we can take home happy message.
Definitely, sir. Science has moved to this thing, and because of ART and all such treatment options which are available, these things are possible. But you also rightly mentioned about the complications which may happen due to when a woman wants to conceive after or during the age of menopause, and because of the age related issues or already present complication in our body. So while you were explaining all such things, I was getting this in my mind to a recent case of a celebrity. I would not name it, but I think only after that case this bill sparked and the age limit was set. So I think now I'm much more able to understand why that age limit was mandatory, so that it won't add any further complication to the woman's health and
Absolutely.
also to the baby's health. So
बल्कि 70 साल की उम्र में भी टेक्निकली हम प्रेगनेंसी अचीव कर सकते हैं, पर
so
विल वी बी एबल टू लुक आफ्टर एंड रेयर द चाइल्ड. सो ये
yeah.
एक इशू था, एंड आई एम थैंकफुल टू इंटस एंड यू एंड ऑल द पीपल हु आर नाउ लिसनिंग लॉक्ड इनटू दिस पॉडकास्ट. इट वाज वेरी इंटरेस्टिंग, इसलिए आई एम थैंकफुल टू देम टू अलाउ अस टू टॉक ऑन दिस टॉपिक.
I think so, and I would again mention about this. This topic would require another session, and we'll definitely plan something around this as well, so that we can talk in depth about this. Moving on to my next topic, that is diagnosis, detection, and testing. Starting with Dr. Jignesh. So, what are the most reliable methods for diagnosing menopause, and how do healthcare providers differentiate between menopause and pre-menopause?
फर्स्ट ऑफ ऑल थैंक्स टू एआरटी लॉ कि उन्होंने ये उम्र तय कर दिया कि 50 साल तक यू कैन गो फॉर प्रेगनेंसी. अदरवाइज सिर्फ जन्म देना, माँ बनना बराबर नहीं है. बच्चा बड़ा करना, उसका लालन पालन करना वो भी जरूरी होता है. सो थैंक्स टू एआरटी लॉ. इंडिया में तो आई थिंक डॉक्टर कौस्तुभ 72 years इज द रिकॉर्ड, नो?
Yes, in fact, not just a record. On before the law was passed, we have had a woman who was near retirement before the law came in, and this was a point which was very hotly discussed. So I was trying to point out that you need not just a family unit, but what if the child asks the question to the mother कि आप इतने बूढ़े हो, मेरे बाकी के जो फ्रेंड्स हैं उनके जो है वो उनके माता पिता इतने यंग है. Now this is a straight fight, a debate which nobody can answer adequately. So I'm sure you have brought that out in this, while you are commenting on it. Go on, please.
Simran, what is the question? Please repeat.
So I was asking about what is the most reliable methods for diagnosing menopause, and how do healthcare providers differentiate between menopause and perimenopause?
So first thing is regarding the diagnosis of menopause, you need not to go for any test because it is a clinical diagnosis and आपको पता चल जाता है कि जब आपकी साइकिल्स इरेगुलर हो जाती है, स्कैंटी हो जाती है, तो आपको पता चलता है कि यू आर पासिंग थ्रू द स्टेज ऑफ मेनोपोज ट्रांजिशन. एंड उसके बाद धीरे धीरे करके बाद 12 मंथ का एमेनोरिया हो जाता है एंड यू बिकम post menopausal. Then one more thing we were taught by taking vaginal pH, sometimes you can diagnose, but now it is obsolete, it is outdated. And third is the progesterone withdrawal test, because for progesterone withdrawal, the endometrium should be estrogenized. The postmenopausal ladies endometrium is not estrogenized, so उसमें progesterone withdrawal नहीं आएगा. So these are the tests uh, for diagnosis of menopause and menopause transition. एंड क्या होता है मेनोपोज में कि एफएसएच हार्मोन आपका बढ़ जाता है, और दूसरा ये ईस्ट्रोजन लेवल डिक्लाइन होता है, क्योंकि फॉलिकुलर एक्टिविटी नहीं होती है तो ईस्ट्रोजन लेवल प्रोड्यूस नहीं होता है। तो ईस्ट्रोजन कम हो जाने के कारण ईस्ट्रोजन रिसेप्टर्स एक्टिव नहीं होते हैं, और पूरे बॉडी में ईस्ट्रोजन रिसेप्टर्स होते हैं, और वो ईस्ट्रोजन रिसेप्टर्स एक्टिव नहीं होने के कारण ईस्ट्रोजन डेफिशिएंसी के वजह से ये सब मेनोपॉज रिलेटेड सिम्टम्स होता है। Menopause transition generally it occurs after the age of 40 years. Sometimes it is lasting up to 8 years. Sometimes it is lasting up to 2 years. That is about the diagnosis of menopause. What was the second part of the question?
So, how do
How to
healthcare providers
differentiate? Yes,
differentiate
how to differentiate. That is transition when you are getting periods within 12 years, within 12 months. तो ये मेनोपोज ट्रांजिशन का फेज है। दूसरा प्रोजेस्टेरोन विड्रॉल में ब्लीडिंग आता है तो ये मेनोपोज ट्रांजिशन है। एंड आफ्टर 12 months of spontaneous amenorrhea it is menopause. That is the point of differentiation. But in infertility setup, they are going for estradiol test, they are going for FSH test, they are going for AMH test. But that is for the infertility workup, not for the diagnosis of menopause.
Thanks a lot, Dr. Jignesh, for spreading that awareness on the reliable methods of the diagnosis and how we can differentiate on such menopause and perimenopause. Moving on to my next question to Dr. Sneha. Ma'am, we know that women who are experiencing menopause and are not much aware about what exactly it is, they are so much in confusion by themselves until unless they go to a doctor. That what is happening, how do we get this detected, what is happening with our body or the symptoms which are they facing. So what specific lab test should women consider during the menopausal transition, and what key hormonal levels are typically assessed for this?
Before we go there, can I request you, Simran? I had mentioned, and my fellow panelists also, there is a medical emergency right now in the family. So I had requested that I would be needed there, and I had hoped the discussion would go through without me requiring to intervene and step out. I hope Simran and my fellow panelists allow me to step out at this point, and I'm sure we'll meet at other fora. And thank you for the opportunity to intest.
That's fine, sir. We understand. And thank you so much for handling that family medical emergency, and also being part of this enthusiastic panel discussion, being one of a wonderful speaker here. So we
Thank you.
understand. You may leave.
Thank you and have a great day.
Thank you so much, sir.
Yeah. So coming to your question, I hope I'm audible. I'm joining from mobile now.
Yes,
Can
ma'am,
you
you're
hear
audible.
me? Yeah.
We can
Yeah.
hear you.
So yeah, as you said that what are the definite tests? So before that, I would say as Dr. Jignesh has already said, it's a perimenopause, menopause, and postmenopause. So menopause is not one particular. In fact, that is a spectrum. That covers the entire spectrum. That 5 to 7 years before stoppage of menstruation, 1 year after stopping the menstruation, that is menopause, and then postmenopausal period after you stop your menses for 1 year and till the entire rest of your life. So that is what is postmenopausal period. And as we discussed earlier, I think I missed that part, that mental changes, mood swings, and all these things. The woman start experiencing certain behavioral changes in herself. She feels that she gets angry very easily. She feels nervous very easily. She maybe overreacts to anything, and maybe she feels that she's neglected. Nobody is paying attention to her, and maybe even the kids are not listening to her. The husband is not very responsible. So all these things, she feels so. These are the symptoms actually which tell her, and you also realize irregularity in the menstrual pattern and the behavioral changes. You get all those, changes because of the osteoporosis. You start getting all the bony pains, especially the severe backache and leg cramps, and of course the other symptom. So these are the symptoms which tells you that you are approaching menopause. There is definitely no need for some investigations unless it is in the context of some research. But maybe when you are planning, especially for, I think, the fertility treatment and all those things, I think FSH and LH and estradiol, these are the hormones which actually you have to go for testing. And if you find they're very high in the postmenopausal range, then of course you have different lab values for different labs and you have standards to compare. So if they are in the postmenopausal range, you have certain kits also, the commercially available kits, which can tell you that you have attained the menopause. And one more point I would say here that I think I was supposed to answer that whether it is a stigma. So I think why this question came, I'm really surprised. Um, just your advancing age is not a stigma. As Dr. Jignesh has already said, that me no pause. I think it's about the working capacity of your office people, your work people. They may doubt that your capacity may go down, maybe because of your forgetfulness or brain fog. You're trying to forget things, so your efficiency at work. These are few things, but they are not to be stigmatized, I would say. In fact, by doing certain exercises, having a healthy lifestyle, healthy diet, and regular active physical exercises, especially the aerobic exercises, having some brain games can improve your mind power, and that is how I think you should get away with all this. What the so-called stigma is, I don't think we should ever call it as stigma. In fact, the woman herself should understand that it is a part and parcel of her natural course of her life, and she should be well prepared to tackle with this situation. Just to make a sentence that there are so many studies that most of the creative, productive work has been done in the postmenopausal age group. So I think that is enough evidence that we can say that it is not a stigma. Thank you, sir.
You rightly pointed out, ma'am. This is not a correct word to use around menopause or stigma, because it is just a phase of life. Your body is going through some changes. The organ has a limitation to work, and it's just that it is stopping at a right point of time. And when some system or a machine is being stopped, it will have its repercussions, or let's say few of the signs and symptoms which we call, that the body will witness. So, and Dr. Jignesh also rightly mentioned that me no pause. If I'm going through a menopause, I'm not, that means I'm not going to stop. It's just, a phase, and I'll continue to work, or my body will continue to work. So, thank you so much for clearing out that. Moving on to my next question to Dr. Deepti. Ma'am, how can symptoms tracking help in diagnosis of menopause, and what should women include in their symptoms diaries if they have to?
Right. Menopause is not a short period. Average women have to live with this all the symptoms and agony of hormonal depletion almost her one third of life. I think average 20 years or more than 20 years women have to live with this all the symptoms. So at what stage patient is coming, that is also important. And for the long period, these patients are also not coming regularly. So diary is very important to trace the how much improvement is there, what symptoms have improved. And second thing is, the patient who is suffering from vasomotor symptoms in early phase of the menopause, these patients are very likely candidate for having cardiovascular accidents. after 4, 5, or 6, 10 years. So we can keep them in the high risk group also. This osteopenia patient who are having osteopenia in initial phase of the menopause, they are also liable candidate for the osteoporosis, sarcopenia, and other health conditions. Like a patient who is having cardiovascular accident, these patients are very likely candidate for the depression. So we can provide the mental support, and we can aware the family members about these situations. And second thing is uh, grade, means if patient is in the severe grade of the some symptoms like hot flushes, sleep problem, deprivation of the mood, so 0, 1, 2, 3 grades we are giving according to the symptoms severity. And when the patient is coming after a few days or few months or 1 year, at that time with the medications, how much patient symptoms have improved, what was the third grade, it was in second or one. And patient, if diary is there, then patient will be also very much punctual also. So I have to take the medications, I have to show the this diary to my doctor. And in the last time we can conclude more things from the patient. So diary tracking is very important, I think so.
I'm so sorry, I was on mute. I was just saying ki, you rightly said diary, maintaining diary and mentioning all such things will definitely help the doctors and as well as the patient to communicate all such symptoms and everything to the doctor, and so that it is better for doctors to assess what exactly is going on and how they can treat, what are the, what, like you said, what are the grades or the degrees, and what specific medicines or things can be done for the betterment. Moving on to my last topic for the day, that is the treatment and management. As we have very less time, so I would request all my panelists, we can, if we can briefly cover this. Moving on to starting with Dr. Jignesh. So, what clinical criteria do doctors use to assess severity of menopausal symptoms in patients, and how does this affect the treatment decision?
So this is about the menopause rating score, that is MRS scoring system. It is available on Google and it is available in 10 languages, but in Hindi it is not available. We can download this scoring system. We can explain the patient in their vernacular language and get it filled by our staff. There are 11 symptoms. Four are physical symptoms, four are psychological symptoms, and three are urogenital symptoms. The symptoms are like आपको अचानक से गर्मी लगती है, पसीना हो जाता है, या आपको हार्ट का डिस्कम्फर्ट, पाल्पिटेशन, ये घबराहट हो जाती है, आपको नींद बराबर नहीं आती है, आप सडनली डिप्रेस हो जाती है या सडनली आपका मूड अप हो जाता है, आप पूरी एंग्सियस हो जाती है, आपको एट द एंड ऑफ द डे बहुत थकान लगती है, यू डोंट फील गुड एट द एंड ऑफ द डे, आपको कोई सेक्सुअल प्रॉब्लम्स है, फिर आपको ड्राइनेस लगती है, आपको यूरिन की तकलीफ है, ऐसे 11 सिम्टम्स है एंड वी कैन स्कोर देम accordingly 0, 1, 2, 3 and 4. For no symptoms it is 0, for mild it is 1, for moderate it is 2, for severe it is 3, and for very severe it is 4. And accordingly, the minimum symptom score can be 0, maximum symptom score can be 44. If the symptom is 0, scoring is 0, then patient is asymptomatic. If it is 11 or less, then she is having mild menopausal symptoms. If it is less than 35 and more than 11, then she can be termed as a having moderate menopausal symptoms, and more than 36, she can be termed as having severe menopausal symptom. So accordingly, we can plan the management of menopause, and after each subsequent visit, we can again plot the score and we can find out how much we have achieved, our treatment is working or not, that we can assure the patient. So this is about the menopause rating scale.
I think the menopause rating scale, which you just explained about us, most of us or most of our audience are not aware of this. And I believe as much as it is necessary to be aware about what is the thing happening in their body, the changes, signs and symptoms, patient or the person should also be aware about the treatment options and how we can manage it, so that they have the complete awareness around this, and they are aware or briefed about what are the things could happen and how to treat this. Moving on to Dr. Sneha. Ma'am, how can we evaluate individual risk factors like family history or personal health issues before recommending hormonal replacement therapy or other treatments? Dr. Sneha, you're on mute and we cannot also see you. I think some disconnect. She got
Again,
disconnected.
she has lost the connection.
Yes, yes. Uh, so,
Okay.
Dr. Deepti, would you like to answer what evidence-based alternative therapies like
Yes.
physioestrogens and acupuncture have found effective in alleviating menopausal symptoms?
Yeah. Uh, Other than the medical therapies, so many Ayurvedic, homeopathic, then body mind relaxation techniques, and phytoestrogens, some very so many things are available, but very limited scientific evidence are there. जो भी स्टडी हुई है बहुत एलोबरेट स्टडी नहीं हुई है, बहुत कम पेशेंट में हुई है और लिमिटेड सिम्टम्स के साथ स्टडी हुई है. Population is also different, genetic is also different, the stage patient is taking the medications, that is also different. So it is very difficult to assess the medications effect and effects. So coming to the phytoestrogen, phytoestrogens are working like estrogen. They are estrogen receptors modulator. मतलब जो estrogen के estrogen जो काम करता है उसके जो receptors होते हैं वहाँ वो act करता है और like estrogen उसकी effect देती है. और जो phytoestrogen है उसका जो form है वो either we can take from the food, natural source. नेचुरल सोर्स में है चिक पिक्स है, फिर सोया है, लेंटिस है, उसमें से मिलता है. और 45 टैबलेट्स आती है, फूड्स आते हैं. लेकिन एक रेड सिग्नल बहुत कम टाइम में बोल रहा है, तो एक रेड सिग्नल है फाइटोएस्ट्रोजन के यूज के साथ कि अपने ज्यादा यूज कर लिया तो इट विल अफेक्ट एक्ट लाइक एस्ट्रोजन, एंड एस्ट्रोजन इज नॉट गुड. एक्सेसिव अमाउंट ऑफ एस्ट्रोजन इज नॉट गुड फॉर द लेडी एट द एज ऑफ 50, मोर देन 50. उसका कार्डियोवास्कुलर सिस्टम पे इफेक्ट होता है, ब्लड पे इफेक्ट होता है, कोलेस्ट्रॉल पे इफेक्ट होता है, बॉडी फैट का कंपोजिशन में इफेक्ट होता है. तो मतलब ऐसे ब्लाइंडली आप कोई भी कॉन्सेंट्रेशन में कोई भी दवाई से मत लो, डॉक्टर की निगरानी में लो. और ज्यादा से ज्यादा सोया लेने का मतलब ज्यादा से फाइटोएस्ट्रोजन आपको लेने का है तो फूड सोर्स से लो. फूड सोर्स में भी ये है कि वेजिटेरियन जो लोग हैं उनको फाइटोएस्ट्रोजन का जो लेते हैं, सोया लेते हैं, उनका एब्सॉर्प्शन ज़्यादा होता है, ज़्यादा इफेक्टिव होता है. फिर जो लोग नॉन वेजिटेरियन है उसमें सर्टेन अमाउंट ऑफ द soya will not act what in vegetarian people will act. जीआई फ्लोरा भी इफेक्ट करती है. जीआई फ्लोरा अच्छी है तो इसका एब्सॉर्प्शन अच्छा होगा और जो इसका रिसेप्टर्स है उसकी इफेक्ट अच्छी होगी. मतलब सो मेनी फैक्टर्स आर दैट डोंट ब्लाइंडली गो फॉर द सप्लीमेंट्स कि फाइटोएस्ट्रोजन है दैट इज नॉट हार्मोन्स, और हार्मोन्स नहीं है तो अपने सेफली कितना भी ले सकते. थोड़ा अच्छा लगा तो और भी ले लो तो आप कोई तकलीफ में आ सकते हो. बस दैट इज द मैसेज.
Thanks a lot, ma'am,
सबके
for
मन में ये ख्याल रहता है कि
so.
जो नेचुरल है वो सेफ है, बट इट
Hmm.
इज नॉट लाइक सो. सो ओनली दोज मॉलिक्यूल्स विच आर मोर स्टडीड एंड फ्रॉम गुड कंपनीज दे आर टू बी टेकन, और वो अमेजोन से और ऑनलाइन प्लेटफॉर्म से नहीं
या
लेने चाहिए.
ऑनलाइन प्लेटफॉर्म से नहीं लेना चाहिए, उनका सोर्स
Thank
भी
you.
बराबर नहीं होता है. तो यू शुड नॉट टेक फ्रॉम दिस फार्मास्यूटिकल कंपनी से. वो जो मात्रा होती है उसकी जो कंपोजिशन, उसके जो सॉल्ट्स होते हैं उसके साथ वो भी बहुत मायना करते हैं कि कितना एब्सॉर्प्शन होगा, क्या होगा. सो डोंट गो ब्लाइंडली.
So you recommend to go to a pharmaceutical organization, supplements, or any other, or through any other way?
नो नो,
So it's
डॉक्टर प्रिस्क्रिप्शन इज वेरी इंपॉर्टेंट, और
okay.
जो हम लोग
Okay.
लिखेंगे वो भी साइंटिफिकली, क्योंकि क्या होता है कि सोया आइसोफ्लो जो अपना फाइटोएस्ट्रोजन है उसके साथ दूसरे सारे भी कॉम्बिनेशन होते हैं, वेदर इट इज रिक्वायर्ड नॉट रिक्वायर्ड वो भी है। और ये जो उसमें अपने को कैल्शियम भी डाल दिया, विटामिन डी भी डाल दिया, वैसे भी कॉम्बिनेशन आते हैं, तो ब्लाइंडली बहुत कुछ मिलता है। तो डॉक्टर नो कि क्या उसको देने का है, कितना जरूरी है, उसका बॉडी बहुत हैवी है, स्टोरिनाइज है, पीसीओ की प्रॉब्लम है, उसको कोलेस्ट्रॉल हाई है, तो इसको देने का है तो अमुक मात्रा में देने का है। 2 टैबलेट नहीं देंगे हम, 1 टैबलेट देंगे।
So it
जिसके
should
ट्रायल्स
always.
हुए हैं वही ड्रग लिखने की बस।
हाँ,
Thank you so much, Dr. Jignesh and Dr. Dipti, for explaining us the exact way on how can we intake such kind of supplements which will help our body. And one last thing to our audience, that the more emphasis is given that it should be prescribed by the doctors, because it is advised according to the it is advised according to the signs and symptoms, your body type, the factors, and all such things taking into considerations. So, thank you, Dr. Deepti and Dr. Jignesh, for staying for this panel
नमस्कार।
discussion, and being a wonderful speakers for this. And we really had an enthusiastic discussion, spreading
thank
awareness
you.
about menopause, its signs and symptoms, or I should say myths, misconceptions, treatment, detection, and every other such topic. I think this is a very vast topic. We have so much else to cover, but looking forward to more such conversations and collaborations. We'll end this session for today, and we'll look forward that we can meet together and spread this awareness. And thank you so much for sharing your insights and expertise with us. It means a lot.
Thank you. Thank you,
नमस्कार एंड
Simran.
थैंक
Thank you so
यू।
much.
थैंक यू।
Thank you so much. Thank you.
Thank you for conducting very